I can start the presentation. So this presentation is on the public spaces in the RMI. This is for people who are not in labs and doing research. Those are the people that are not attending Vanessa's presentation this afternoon, or the one she did on Tuesday on research. We're doing this to try and get everybody up to speed before we start opening up again. There are some research functions that will begin as, actually they could begin as of Monday. So that's why we're doing all this right now, trying to get some protocols and things in place. So we'll start with what is COVID-19 and what are the symptoms. We want to remind you all to stay home if you're ill. There are different symptoms for things like colds and allergies versus COVID-19, but there's a lot of overlap, so it's really hard to know. If you're like me, you may be having allergy symptoms along with everything else that's going on now. And if you catch a cold, sometimes it's hard to tell if it's allergies, it's a cold, or if it's COVID-19. It's now easier to be tested for COVID-19 than it has been. So you should probably, if you are concerned, contact your doctor to see about getting tested. And if you are diagnosed with COVID-19, we'd like you to report that to your supervisor as soon as possible. And to contact campus health services, the privacy office, and also occupational health or student health. If you're a student, and report, they will then contact you about where you've been and who you've been in contact with. So what will happen if someone working in any of the RMI buildings tests positive for COVID-19? Any exposed areas will be locked down and keycard access will be suspended to those areas. So if there is a reported case and somebody has been in an office or lab, those areas will be locked down, and custodial services will come in and do a deep cleaning before access is restored to those areas. Contacts will be identified and notified through the campus privacy office and health services. It's not something that the department is in charge of doing any of those things. There's a procedure on campus for dealing with those kinds of issues. If you're coming into the building, you will start to see signage around the building. So you will see, as you come to the door, this sign that says face covering required. So in Yolo County, all public spaces, you are required to wear a face mask. And that includes the RMI buildings. So please cover your face before you enter the building. The other thing to be aware of is you're going to require, all public spaces require those face covering, and you also want to maintain a 6 foot or 2 meter distance between people. So these are the general rules that we're going to be following. Public spaces require face coverings, but private offices and some other single-use spaces are exempt from that requirement. So if you have a private office or you're in your office by yourself, you do not need to wear the face covering. If somebody else is going to come into your office and you can keep a 6 foot distance, then you both need to put face coverings on. Public spaces and equipment, such as things found in eating areas like microwaves, they should all be wiped down with disinfectants before and after use. Just to be sure, you want to do it before use because you don't want to trust your fellow workers to have done everything properly. So it's always a good idea to be extra cautious. You want to cover any coughs or sneezes with a tissue or use your upper sleeve. Dispose of tissues and paper towels, any wipes in the trash. And avoid touching any surfaces that are unclean. Somehow my slide got messed up here. So stairwells, handrails, elevator handrails, things like that, avoid touching those. I know it's difficult. We kind of get into the habit. You walk into the elevator and you lean against the rail. Try not to do that. And avoid touching your face when you're out and about. That's one advantage of the mask, is it reminds you not to touch your face. So during breaks, meal breaks, anything like that, all tables will be single occupancy. We have removed extra chairs from the eating areas to remind you to not share tables with people at work. So that maintaining that physical distancing of 6 feet should be observed at all times. Don't congregate in break areas. Don't share tables. Small places like elevators and bathrooms should be considered single occupancy areas. And minimize locations where you work to protect yourself and others. So that's simply to protect you from people wandering around, going places they don't really need to be in the building. It's a good idea to stay in your office, go to the mailroom if that's where you need to go, but don't be just walking around visiting people. This is not the time for that. Mailroom is also considered a single occupancy space. Once people are coming back in, we're going to try just leaving the mailroom door propped open so that people can see whether or not somebody is in there before they enter. So when you go to some office, mailroom, any place, you should cover your face. If you need to enter an office or a conference room or something, then the door is closed. Knock. Do not enter unless you don't get a response. So rather than knocking to get a response here, we're knocking to make sure there's not someone there. So if you are in an office and the door is closed and someone knocks, please respond so that they know that you are there. When you're in the stairwell, again, you want to cover your face and you want to keep communication open at all times. Communication is really key to all of this, letting people know where you are, and just observing where other people are. You will step into the stairwell and you see someone coming up the stairs towards you, step back out into the hallway until they pass. Just maintaining that distance is important. The elevator is considered a single occupancy space now, so please wait for an unoccupied elevator before you go in. You know, wear your face covering while in that elevator, and it would be a good idea to wash your hands or use hand sanitizer before and after using the elevator, because we know that you have to touch the buttons to operate the elevator. So you want to be sure that your hands are clean before and after you go into that elevator. You're trying to protect yourself and protect other people as well. Okay, so again, this is just going over that again. It's a confined space. You cannot distance yourself by 6 feet while you're in the elevator, so you want to wait for an empty one to get aboard. Avoid touching any surfaces, the railing in the elevator, etc. Those are unnecessary to touch, and wash your hands frequently. Bathrooms are also going to be considered single occupancy from now until further notice. One person at a time. We were considering making them unisex, but we got some pushback on that. People did not like that idea, so we're not going to bother with that. The idea of a unisex bathroom was just to make it so that we didn't get lines of people outside the bathrooms. But if people aren't comfortable with that, that's fine. But they're still considered single occupancy. So if the door is propped open, the bathroom's available for use. If it's closed, then it's occupied. So when you enter the bathroom, you want to close the door behind you. That's going to let other people know that the bathroom is occupied. When you're finished in the bathroom, you want to use a paper towel to open the door, prop the door open so the next person will know it's available for you, and then dispose of that paper towel. This was a problem in the BWF building because there's no paper towels in there. It's a green building. So yesterday I put paper towels into the bathrooms in there so people could have something to which, and so they can handle the doors that way. I think most of the bathroom doors now have something to prop them open with, but I'm not sure we've got all of them covered. Okay, and lastly, when you come back to work, there is an employee checklist that we're asking that you fill out and make sure that your supervisor has approved anything. What's on that checklist is just that you have attended this training. Specific work activities, whatever you're going to be doing has been discussed with your supervisor, particularly those of you who are in offices and other places. A lot of your work can be done telework and should continue as much of that as possible. I know that there are things that you won't always be able to do, but as much as you can, you should avoid coming into the buildings. Make sure that you know about disinfecting and how they're going to be used. I put 70% ethanol spray bottles in the interaction area and around the Rossi Terrace. We recommend as much as possible that if you are around and you want to take a break or you want a meal break, that you go outside to eat if you can. That's probably the safest place to be. Otherwise, the interaction area is fine as long as you are using the 70% ethanol as disinfectant, and there should be paper towels available there as well. We'll try and keep up on making sure everything is full and ready to use. You should be discussing with your supervisor what PPE you might need. Typically, that would be some sort of a face covering. But there may also be times when you need gloves and etc. And that you have done this self-inspection. It'll be reviewed, and we want to make sure that everybody is aware of the situation. We know that there are some people who have an issue with wearing masks due to some health concerns, and those people we're trying to encourage to continue to telework as much as they can at this point. Okay, so that is all I have to cover on public spaces. And if you guys have any questions, you can put them into the chat feature right now, and Vanessa will go over them with me.
Does private office include cubicle spaces and walls if they measure 6 feet from the other person?
That will be the call of your supervisor. So supervisors will have different things that they are comfortable with in different situations. It's hard for me to know exactly what your situation is. I do believe that a lot of those would be considered non-mask areas because you can socially distance far enough to not require a mask. But I don't want to speak to your situation without seeing a little more of what's going on in that area. Any other questions?
There's a question, I guess, for me asking if they need to come to the lab training this afternoon, if their lab will not be open for research anytime soon. I would advise it, just as we don't know how long this is going to last and how things are going to change. Yeah, but this will be, if you can't attend this afternoon, both Lucy and my sessions are being recorded and posted to I think the BFTV cluster website under safety resources. If not, I will let you know if they're posted somewhere else.
Yeah, so we will have, we will have those up and posted. I know that there are people who can't attend all of these, so we will have those up by next week